Hello, everyone. Welcome to Ask the Nanny. Thank you for joining us tonight. Tonight we have our special guest, Ask Shelly. Am I pronouncing that right?
You are.
Great, great, great. Now, she's going to tell us a little bit about herself before we get started, and then I'm going to make a disclaimer. While she's telling us um about herself, I am going to share this with some of my Facebook groups. So,
Ooh, I need to do the same.
so, Miss Shelley, when you finish
Yeah.
sharing, please tell us a little bit about yourself and a little fun fact.
Absolutely. A fun fact. Okay. Let me think. Let me think. So my name is Shelly Fan. I am a licensed psychotherapist here in the state of Florida. I am the founder and CEO of Ask Shelly Consulting, which is an emotional intelligence firm that works with corporations and other business entities just to bring them to their next level, to bring them to peak performance through the provision of psychoeducation and other psychological support to get them to thrive, to be in full throttle mode. I am also the co-owner of Harmony Mental Health and Behavioral Services, which is an agency that provides services to the ages of 2 to 99, providing an array of psychotherapeutic services in order to assist people with overcoming emotional issues, mental health diagnoses, all types of illnesses, mental illnesses on a spectrum going from being functional and just having just minor emotional disturbances all the way to severe and persistent mental illness. And we treat all in between on this spectrum. And so that is basically what I do. I'm the mother of two amazing children. I am a Haitian American, proud Haitian American woman originally from New York. And a fun fact, let's see. Wow, I'm a really pretty boring person. I eat a lot. I can eat a pie of pizza all on my own. I guess that's a fun fact, kind of gross too, but it's true.
Well, it
And
just depends on if it's small, medium, or large.
I could probably knock down a large.
Wow.
I could probably knock down a large. I eat a lot. But I guess another fun fact that some may not know, I guess, well, maybe many people do. I love to dance. I am an ordained minister. And so I love to incorporate my experience in dance in that realm. So I was a liturgical dance instructor for many years. I no longer do that. I don't know if I could lift my leg past anything right now, but so that's a little bit about me.
Okay, great. Now we're going to get ready to get started. Um, okay, my eye is watering because allergies. Just because. Excuse me. We're going to get started. We're going to be talking about children with obsessive compulsive disorder. Now, first of all, I need to give a disclaimer.
Okay.
I am not a doctor. I am not a therapist. I am not a counselor. I'm not licensed. I will give you my opinion. I will give you my things that have worked for me, but that's my opinion. Whatever you do and whatever is said tonight, please check with the parents of your children and have them to check with their doctors before you start any kind of treatment, any kind of behavior modification, anything. Be sure you check with the parents first. Let me repeat that for those in the back. I am not a therapist. Now, Miss Shelley, on the other hand, is a licensed mental health consultant, but a counselor rather. But even what she says, check with your child's pediatrician, check with mom and dad before you try anything that is suggested tonight, even an opinion. Check with mom and dad, check with the child's pediatrician, because we are just talking and giving advice and giving knowledge and sharing information. We are not your child's doctor. We don't see them every day like you do. So check with the doctor and mom and dad before you do anything.
Right.
Now, with that said, um, obsessive compulsive disorder. Now, can you give us a definition of that? Because some of us are just compulsive and not necessarily obsessed with it.
And you know that term, isn't it overused? You meet someone who likes things a certain way, and what do they call themselves? Oh, I'm OCD about this. I'm OCD about my car, or I'm OCD about my kitchen, right? And it's
Mm-hmm.
so much deeper than that. So, obsessive compulsive disorder is a psychological disorder. It's a brain disorder where an individual is burdened by thoughts and feelings and urges that are unwanted. And these feelings and these thoughts and these urges are so intrusive that it causes some level of dysfunctionality in major areas of life. And I think that that is the key thing that we're looking at as therapists and other mental health professionals is what is the dysfunction, right? And so it's when these thoughts become so intrusive that it's affecting, since we're talking about children today, affecting their ability to thrive in school, to thrive in the community, to thrive within the home setting even. So what happens is because these thoughts and these feelings and these urges cause so much distress, it is paired with a compulsion in order to relieve the distress. And so the compulsive part of the OCD, the C in OCD is the actual behavior. It's the mental acts. It's what a person engages in to relieve the distress. So, just as an example, let's say that the unwanted feeling or thought or urge has to do with I have germs all over my body that's going to kill me. Let's just say that that is the thought,
Right.
right? And so the obsession is this idea that I'm going to die as a result of germs. The compulsion is I take a shower over and over again to try to relieve the distress. What happens with this cycle is that because I have temporary relief from the distress as a result of taking the shower, then that is my go-to to relieve the discomfort. And so taking a shower then reinforces the thought and that distressing thought and feeling. And then it becomes this super like crazy cycle, right? That just doesn't, and I hate to use the word crazy. let me rephrase that because I know that's a very derogatory term. The cycle becomes completely reinforced. It becomes strengthened because the temporary relief of distress then reinforces the actual thought. So that feeling, that urge of, oh my gosh, I'm going to die as a result of germs or some type of contamination gets strengthened. So every time the person engages in that compulsive behavior, it then strengthens and reinforces the thought, which then increases the frequency of the behavior. And then we have this vicious cycle, and it just goes around and around and around. And, you know, I want
Got
to
it.
say this. What I love about your invitation is that this is not something that you hear talked about a lot. As a matter of fact, it's very easily misdiagnosed because most of the time the manifestation happens when children are very young.
Well, that was one of the reasons why I wanted to talk about it is because I am a book lover. I love reading books. Because of my eye, I do audiobooks a lot. Um, I very seldom, I'll read children's books because they're short, but my eye will start to water like it was doing now. It get tired and starts to water. And I know you can tell there's a difference between my eyes. Um, but it just won't allow me to read a full book like I want to because I can sit down and read for 2 or 3 hours at a time. I was listening to a book, and this child in the book was mad at his dad, but he didn't want to tell his nanny about it. And his nanny was the same, similar. She had similar thoughts when she was young, so she recognized what was going on in the child, and the child was like 6 years old. And she shared a little bit of herself. She noticed a drawing where he had a smiley face on the nanny, he had an angry face on the mom, he had an angry face on the daddy, and he had a knife in his hand and an angry face in the picture. So she drew a picture of her family and she invited him into the classroom during recess and she talked to him about it. And she was telling him about how family dynamics are made up differently and that she grew up without her dad and she grew up with her mom and how she would obsessively wash her hands because they seemed like something was crawling on her all the time. And because it was crawling on her, she kept washing her hands and washing her hands. And it kept her from doing other things that were important to her because she had the compulsion, I'm something is crawling on me, so I need to wash my hands. So she talked to the little boy and come to find out he was having these thoughts that if he didn't protect his mom, that his dad was going to get mad. And he was scared that he was going to hurt his dad because all these thoughts were going on. And when they finally took him to a counselor, they told him that he had the obsessive compulsive disorder. And I was like, what? Really? So I was like, I got to find out about this. I got to research this. I got to have somebody on Ask the Nanny to talk about this because we don't realize that some kids, we think they just want to be a perfectionist. And that being a perfectionist can actually be OCD.
Absolutely. Absolutely. We have children depending, and this is the thing because I often get asked what the symptoms are, and it varies from child to child. It could be different. The obsessions can be different. I think that when we think of OCD, some of the general ones, the common ones that we kind of can wrap our minds around is the germ, right? The germs and the contamination, which the compulsion for that obsession may be the frequent showers or the frequent changing of clothes or the frequent hand washing. Then we have the obsession, which is I have to protect my family from harm. And so we see the compulsion of the going back to the door and locking all the doors and making sure all the doors are locked and all the windows are locked, right? Or this is the only outfit that keeps me safe and people are out to harm me. The compulsion would be wearing the same clothes over and over and over again because it helps them to feel safe. It could be symmetry. Just when things are out of order, I'm not safe. So we have children that the room has to be a certain way. The teddy bears have to be faced a certain way. The door has to be 45 degrees open or all the way closed or all the way open in order for them to feel safe enough to sleep. Or the chairs in the room have to be faced in this direction. The colors in the closet have to be this way in order for me to be safe enough to sleep. There's so many different manifestations of obsessions and what those compulsions, those compulsions to ease that distress can look like. And so in having said that, it's important for us to be able to identify the obsession in order to really help the child in overcoming the obsession, hence the compulsive behavior that comes along with it.
Okay. Now that brings me to another question. Because it manifests itself in so many different ways, I'm wondering that if some of these children who have been diagnosed as high functioning autistic children are actually OCD.
You are really you're just opening this we're going to be here for 5 hours. So
That's just how my brain thinks.
Yeah. So it's so interesting that you say that, because doesn't it look like that? Like when you're working with children with autism, you see the same type of, the obsession with symmetry. Things have to be straight. They're always straightening out. They have this repetitive behavioral cycles that just press restart, restart. You watch them as they're self-stimulating themselves, and you see that kind of repetitive behavior to stimulate themselves. And when you see a child with OCD, you can kind of see the same thing. They're going by, they go by the stove 5 times, straighten out the plate, straighten out the refrigerator, then go back to their room, come back out 5 minutes later and do the same. So yes, I think that misdiagnosing happens much more than we think. One of the things that I speak about a lot when it comes to undiagnosed trauma and how the manifestation of trauma in children and what that looks like, because trauma in children tends to look like what ADHD looks like. The hyperactivity, they don't feel safe. So that hypervigilance and always looking and not necessarily feeling safe looks like what? Hyperactivity. And so we say that they have ADHD because they're not able to focus, they're hyperactive, etc. But then when we go into the history and realize that this child has been exposed to aversive situations, an aversive environment, this child has been a victim of trauma, has experienced trauma, then we start to go into other things, which is what? Children, many, and adults. People who experience trauma also undergo a level of brain injury. Brain injury that causes them to make the same mistakes over and over again, an inability to forecast the consequences of their actions. Their emotional centers of their brain are overactive, at times underactive. And so here we are, we're calling that child, oppositional defiant disorder, or ADHD, attention deficit hyperactivity disorder, and no one is addressing what? The trauma. So yes, madam, there are misdiagnoses, and because the symptomology for high functioning autism and the manifestations of OCD look so similar, absolutely, I agree that there's definitely a high rate of misdiagnoses as it relates to OCD in children.
Okay, now I know at school, children have rituals. There's a little ring on the door. They go by and they ding every time they go by. Ding. That does not necessarily mean that they have OCD, but it's just something that kids do. But if you got a child is sitting at their desk and the teacher's saying, stop erasing because you're tearing holes in your paper, and the child can't focus because I didn't get that completely right. That E does not look like I want it to look, so they keep erasing and they keep erasing and they keep erasing and they keep erasing because it's got to look like what they feel like it should look like. Now, I was reading in my research that some children, the teacher is talking, but they can't hear the teacher because they're so focused on getting that letter E just right. Now tell us, I'm not a counselor or anything, but I know my mind I get so hyper focused sometimes. I can't hear people around. I'm like, huh, what did you say? Oh, you were talking to me?
Thank you. Thank you. So you can relate to how difficult it would be to attend
Yes.
to any information outside of that process going on in your head. Some of us can't even stop our thoughts to get a good night's rest. So can you
That's
imagine?
me.
Come
Oh my
on,
gosh.
right? Like I can't, and I get people that come into the office and they don't say anxiety. They don't know how to explain it. They're just like, I just can't get my thoughts to stop, right? And that is the definition of anxiety. And that's most of us, right? That have that issue, and we're not really able to put a name on it. But yes, you are right. So here I am, and I am, just think about having earbuds in your ear. And it is like on full blast, and you're blasting music, and you have teachers here saying, it's time to move forward. But you got these thoughts that are so loud in your head. I'm not talking about voices, because the power of the thought, although it's not necessarily auditory hallucinations, don't get me wrong, but the power of the thought, the power of the urge, it has the person completely zoned into that one thing. I can't step on any crack in the floor or else I will die. And so that is the one thing that a child is focused on. You brought up a very good example, a child who says, I will fail if I touch the line. And so here they are, and they're erasing the E and rewriting the E, and erasing the E and rewriting the E, and erasing the E. Sometimes there are children that get so stuck in that it takes them 3 hours just to make it through writing one paragraph. This is what we call dysfunction, because so we have this little Bible. We call it the DSM-5, and this is what we use to diagnose individuals and to assure that they meet certain criteria before we say this is the diagnosis. And one of the criteria is if the compulsion is lasting over an hour in a day, then that is considered dysfunctionality. And so when you have a child that can't get past that, and they're rewriting and erasing, rewriting or erasing or rearranging for more than an hour, 2 hours, 3 hours, then yes, you're absolutely right. They're not paying attention to what the teacher is saying. They're not able to attend to that because the power of the thought is so strong. They're not able to, multitask, if you will, and attend to any other directives outside of this urge that has them zoned into, if I don't do this correctly, I'm a failure. Or if I don't do this correctly, I will die. If I touch a line, I will die. If I submit it. And a lot of the times the thoughts and the urges are irrational. They're not rational thoughts, but it's so overwhelming and so bombarding that it leads the person to respond to it and try to relieve themselves of the distress any way that they can. And a lot of the times that way is that repetitive behavior that we see children with OCD displaying.
So we have a question. Lucretia wants to know, can a traumatic event happen at birth? You spoke
Absolutely.
earlier about a traumatic
Trauma?
event, the trauma happening, and nobody's addressing the trauma. She wants to know, can it happen at birth?
Absolutely. So let me say this, and this is so amazing. Do you know that trauma, that a baby can experience trauma as a result of attachment injury, which is why it's so important. What do we do, or I'm saying we, like I'm a nurse. What do nurses, medical professionals do when the child has to stay in the hospital after birth, right? The child has to stay in the hospital, mom and dad, or mom is released. What do? They tell mom that you have to come back every day and do what?
And visit.
Skin to skin contact, right? That skin to skin contact to minimize the chances of the baby experiencing attachment injury, which is a form of trauma. As a matter of fact, there are studies that show when you are adopting a baby at birth, this is so amazing, Angela. When you are adopting a baby at birth, let's say the baby's coming straight from the mother's womb into the hands of the adopted mother, that too can lead to some level of trauma. Why? Because that adoptive mother is not the voice that that baby has heard for 9, 10 months. You see what I mean? Even that
Yes.
is considered, that can cause emotional injury. Trauma can be in vitro. Alcohol
Yes.
abuse, drug abuse,
Yes.
in vitro. And
Yes.
so we have these children that are being misdiagnosed, and they're being given Ritalin and all types of other stimulants for
Oh,
ADHD, and no one is addressing the brain injury that's a result of what? Trauma.
hello. My son was misdiagnosed with ADHD because my mom was a kindergarten teacher. She taught him how to read at age 4. Now, he was smart to start out with. So when he gets to kindergarten, of course you're not going to sit still. You become the class clown because I know the ABCs. I know the one, two, threes. I know everything you're trying to learn. So why do I need to pay attention? I can read. Y'all can't. Hello. I'm gonna go over here in the corner and I'm gonna just, create a ruckus. When I tell you my son had a disciplinary folder this thick,
Wow.
simply because he was taught early and because I'm a teacher too. So I teach my children, and that shouldn't be a hazard to other teachers, but I had to send extra work to school with him to do in the classroom while the other kids were learning because he couldn't sit still. Now, mind you, yes, hyper, I agree. I totally agree with that part. But the attention deficit, no, he had pretty good attention because he was straight A's. When I finally put him in a parochial school and the curriculum was much more challenging, oh, they went away. And I was like, you were just bored. That was the only thing probably wrong with you. You were just bored. And his teacher said, why are you giving him this medicine? He really doesn't need it. And the day he came to me, he said, Mama, I need my medicine so I can act good. That was the day he went to school without it. I was like, if you know and you are relying upon this medicine to bring you down, to act like a zombie, no, I don't agree with that. No. Uh-uh. So that was the day, and it may have been the wrong thing to do, but that was the day that we took him off of that Ritalin.
Ooh.
And yes,
Mm.
because when he would come back up, or whatever way it was going, when that medicine started to wear off, he was a terror. I mean, he was angry. He would sit there and his face, it was like he was breathing fire. I hated that part of it. And even and this may be TMI, but even the smell of when he used the bathroom changed.
Of course.
I
Yeah.
was like, what are you doing after the fact? I was like, what are you doing to your child? No, no. So I became his advocate. I became the person who went in and said, look, this is what's going on with my child. This is what I need for him to do. This is what I need for you to do. I don't care what's going on with it. And when he went to a parochial school, no problem. As
That,
soon as I switched him back, he became a problem. So the teachers made him one of the teachers. I remember in high school, one of the teachers made him his assistant because the teacher was teaching calculus and they didn't understand. He would go up there and explain it to them in the way that kids and explain to the kids in the way that they could understand, and they got it. And I'm like, when the teacher told me, "Oh, he's my assistant teacher," I'm thinking, "What?" But then when I got it and I realized how much it was helping him to stay out of trouble, to stay, for them not to call me, your son is acting crazy again at school. Your son is doing this. Your son is doing that. It's because he was just in the 7th grade. He was reading at a 12th grade level. He was doing all this stuff and beyond where he was, like 5 grades beyond where he was. And I know it's because All the things that he was learning, they were teaching, was on grade level, but he was above that, so he was
Wow.
bored. So therefore, he became class clown. And I was like, you don't want to be known as class clown. So all of these things that you're saying, that the misdiagnosis,
Yeah.
me putting him on medicine, he was on medicine for 3 years. And I was like, no, what did I do to my child? So I'm very, very cautious after that. I'm very cautious. I will go to Dr. Google and find out what's wrong with this medicine, what are the side effects, all this good stuff before I put it in myself, and especially before I give it to my children. And I encourage all the new parents that I work with, I said, before you just trust the doctor and give your child this medicine, make sure you look it up and find out what the side effects are, because there could be something, in your family history, or this child could be allergic to something in this medicine. Find out about the medicine and not just trust the doctor and just shovel it in their mouth. I'm not saying don't give it to them. I'm just saying be informed.
I love it. Yeah, absolutely. We have to be the experts, right? And it's important to be the expert in your own wellness and the wellness of your children. And you said, you made a comment like, what was I doing to my child? I just want to just address that you were doing what you thought was best for your child. And I think that as parents, we tend to kind of go hard on ourselves
Yeah,
when these situations, right? Because we're like, oh my God, no, you were doing the best that you thought you were doing the best that you could for your child. And there are children that absolutely need it. Don't get me wrong. I'm not saying every child doesn't have ADHD, because there are children that do. There are children that need therapy. They need behavior therapy. When that has deferred success and you have tried it and you have made sure that you have aligned yourself with a therapist that is equipped, that's anointed, that understands behavior, that understands motivation, that understands how to connect with children, and it's not working, when you have tried lesser restrictive alternatives, right? Lesser restrictive alternatives, then absolutely medication is an option. I'm not one to say that medicine is bad. I have seen medication help my clients go from F's and D's to straight A's. And so there are children that absolutely need that. It doesn't mean that every child needs that, which is why it's important to be an expert in your child's wellness. Do the research, make sure you're getting second and third opinions, and making sure that you're aligning with people who are trained, right? Who are experts in the field. I don't go to the eye doctor for a root canal.
exactly.
And so be careful that you are making sure that you're aligning yourself with professionals that are experts in that particular field.
And if you don't feel comfortable with that doctor, and you don't feel comfortable with what they're saying to you have the right, as your child's advocate, as your child's parent, to go to another doctor and get a
Correct.
second opinion.
Correct.
Use that motherly instinct within you, that sense of discernment within you. God didn't give it to you to just let it go to waste. Use it, because if something is telling you something is just not right, believe it. Get a second opinion. And if that opinion doesn't work for you, get a third opinion. I have seen documentaries where people have told families that your child is this. And the next one says, well, it's pretty much the same. And mom is like, no, that's not it. That's not it. That's not it. I had a woman, saw a woman who went to 6 different doctors. And when she got to the sixth doctor, it was like 4 or 5 months later. And she was trying the things that the other doctors told her. But when she got to that sixth doctor, and that doctor said, no, let's look at something else. It's a rare thing, but let's look at it. They looked at it, gave her some medicine, the child, just like that. I mean, it was like within
Wow.
days. And I was just like, so I'm telling you, if you don't feel right about what the doctor is telling you about your child's behavior, the compulsive behavior, ask someone else. Check out another doctor. Even if you have to get a referral, because I know some insurance companies require you to have a referral to go to another doctor and a referral to go to another doctor. Bug your doctor until he gives you that referral. I promise you, my child had chronic ear infections. We were in the military and they kept saying, here's some medicine. We took medicine for over a year. Soon as we stopped the medicine, the ear infections came back. Here's some more medicine. So we took that for 6 months. And in the meantime, I'm like, don't we need to go to ENT? Don't we? Hello, can we go to ENT? No,
Wow.
he's fine. And they're taking audio tests and he's barely passing them. So he's okay. But me being mama, my mama taught me to be a rattling wheel. A rattling wheel gets a lot of attention. So sometimes, mamas, you have to be a rattling wheel. I finally took him. We were between duty stations. I took him on my own dime to an ENT. We were getting ready to fly to Alaska. We're coming from Arkansas. It's a long trip. The
Yeah.
doctor told me it would kill him if we got his eardrums would literally burst and bleed out.
Yeah.
I was like, say what? Now, mind you, we had been on medicine for um, a couple of almost 2 years. And I was like, okay, so we went. Guess what? We got another set of tubes. We got some tubes put in there. We perfectly fine. We
Wow.
flew. We done. But the thing about it is, if you don't feel that the diagnosis that your child is getting, get a second opinion. Sometimes it has to be on your own dime and on your own time. Get that opinion. I took that report back from the ENT, took it back to the doctor on the military post where we were not stationed. We were between duty stations, so I could go anywhere I wanted to. I took it to that one, and they signed me another doctor outside of the military, and we got that surgery done.
Wow.
So I'm just saying, you need to do what you got to do to protect your child. Because just imagine if I had gotten on that plane with my child, and imagine this is the first plane ride for all your kids, and your child dies in your arms.
Whew.
Every time I think about that, it gives me chills. God did not give you a sense of discernment for you not to use it. And I don't know why I'm harping on this, but somebody needs to hear it.
Right.
Go get a second, a third, a fourth, however many you need. Get another opinion about your child and their diagnosis. If they have been diagnosed for ADHD and you don't feel like your child has ADHD, go get a second opinion.
Right.
In the meantime, in between time, take notes. Record activities, record your child's day so that you can have a concrete pattern that you can show your doctor that says, this is what he did today. Don't use your feelings, record what you see. Not, well, I think he's doing this. No,
Correct.
not
Correct.
I think.
Say what you see,
Say
report
what
what
you
you
see.
see, because that helps us as clinicians because you're bringing in your home to us. You're bringing a piece of your house to us, that experience to us. Recordings, tracking, all those things are so powerful and can help us to make the best, the best diagnosis. And the thing about OCD is that parents tend to think, or caregivers tend to think that they can discipline the compulsion, the compulsive behavior, that they can address the compulsive behavior with discipline, as if the child can control it. And it is it's ignorance, it's innocent ignorance to think that the child can control it, because it really gets to a point where it's uncontrollable, that the obsessive thoughts, the frequency and the power of those thoughts, the duration of those thoughts are so intrusive that it causes the behavior to be uncontrollable. And so we have people coming in like, this child needs help. Like, as a matter of fact, can I just leave him here and come back in 6 months? So and it is it's and that's a lot of reason why children get misdiagnosed, because parents are coming in, we're taking what they're saying for face value. It's a behavioral issue, so now we're dealing with it as a behavioral issue and not necessarily a brain disorder, or which OCD is an anxiety disorder. A lot of the times OCD is has co-occurring disorders with it. So that just compounds and just exacerbates the issues. So very often we see children that have OCD diagnosed with other anxiety disorders, such as generalized anxiety disorder, social anxiety disorder. We see co-occurring diagnoses of depression along with the OCD, sometimes even Tourette's along with the OCD. And so making sure that you are working with someone that has, again, I cannot stress this enough, the training and the expertise to really diagnose this is important. But if a parent doesn't know, if the parent is not even thinking about OCD, then they're most likely going to default to, does my child have autism? That's mostly what they're going in for. I think my child has autism, so they're going to a neurologist, they're going to a clinical, whatever mental health professional that is able to diagnose that. Because a lot of the times they're not thinking that this can be OCD. It's just something that, because it's so cliche, I don't know many parents that are recognizing it right off the bat. And there's not much. There's a lot of education out there. But you have to know that that's even an option, to look for that and look it up. You know what I mean? Because, you're looking up autism or, any other behavioral issue. And so it's important that you are becoming an expert, that you are doing your research and making sure that you're seeing professionals that have training in the area that your child is in need of. I don't know if that makes sense. So if it's trauma, if that's the issue, then you want to align yourself with a trauma-informed provider, someone that understands how to work with trauma, someone who is EMDR certified, which is a certain intervention that professionals, mental health professionals use to address trauma and getting the brain healed, right? And so again, making sure that you are going to the right provider. You don't go to your dentist to get your eyes checked. It's that same concept. Be careful. And I love primary care physicians, don't get me wrong. I have seen primary care physicians save people's lives, right? Like, because, for someone who doesn't have a psychiatrist and a primary that's giving them something to ease their anxiety, or something for the OCD or whatever, because primary care physicians can do that. But I always recommend that you go to a mental health professional, a psychiatrist, a psychologist, to make sure that, and if you got that initial prescription from your primary, awesome, make sure you're following up with someone in the field that has a specialty to be able to assist your child.
Now, you said something that got my brain just twisting again. I had a whole nother lineup going on over here, but you said something that triggered, and that's it, the triggers. Now, PTSD. The PTSD causes people to react to things differently. PTSD also has, because my husband has it, but sometimes I think he's obsessed with stuff. And it's like, and I'm like, why do you keep doing this over and over and over and over again? And I'm thinking that it's connected. to, and I'm wondering, can someone who has gone through this is going through this PTSD, can it cause the OCD in them or cause OCD to happen because they have been through this trauma and they're still going through it? Can it cause all of that to and OCD to come upon them, and they do things because they think they're protecting themselves from whatever this PTSD is going on inside of their head?
Okay, well, that's a really good question. So first, let's talk about what OCD is. Remember, OCD is a biological disorder. It's
Right.
genetic. So what we're finding is that children with OCD, we are able to look in the family tree and see mom had it, grandma had it. It's genetic, and so when it's not genetic, it can be tied to certain infections that cause it. It's a brain disorder. The brain
Okay.
is not producing enough serotonin, and it's affecting the areas of the brain that's responsible for habit and suppressing responses. So the area of our brain that's responsible for suppressing responses, which is I'm not punching you in the face, even though I'm mad at you, right? Brain function. So the part of your brain that's responsible for suppressing responses is also the part of your brain that's responsible for habits. Is there something wrong? They're able to look at brain images of individuals with OCD and those without it and see marked differences. What those differences are, I think that the jury's still out on that. I'm not a scientist, so I'm definitely not going to speak on that, but I know that I haven't read any definitive information about what specifically those differences are, but we know that those areas of the brain are where the impact comes from. So the medication for OCD are SSRIs. They are medication that help to address the serotonin issue in the brain. So post-traumatic stress disorder causes people to operate in their trauma brain. So the stuckness that you see and this repetitive behavior is to address the safety concern that because I'm in my trauma brain, my fight or flight mode is activated all the time. And so when I'm encountered with a trigger, I see everything outside as a potential threat. Okay. And so people in their trauma brain, it's hard for them to absorb new information. That's what people are really struggling right now with this pandemic. We're in our survival brain, right? Fight or flight. And so the emotional centers of our brain are totally activated and on the extreme side of the spectrum. So when you're seeing some of that stuff in PTSD, like he's stuck, you use the word stuck. When you're in your trauma brain, right, you are, what keeps us from being stuck is being able to absorb new information. And that can be applicable to any area of stuck in anybody's life. You're making the same decisions in relationships. You're making the same financial mistakes. You're just going in life and you're going in circles and just think that you continue to press the same restart button on your strongholds. A lot of the time it's because you need new information. Your breakthrough is on the other side of something you do not know. When we are in our trauma brain, we're not able to absorb new information because all of your brain power is going to, we have to survive, fight or flight mode. Everything is a thing, you see? And so what we do with individuals with PTSD is help them to learn mood regulation, learning how to regulate those extremes, learning how to be desensitized to some of those triggers, normalize that so that they can come out of their trauma brain, regulate their moods, and be able to absorb new information. Like, you know what? This isn't a threat and I'm safe. It's kind of, and that's what we do with PTSD. So Can PTSD cause OCD? I would say no. However, I think that PTSD causes symptomology that appears to be OCD. And there's also, and this is a whole nother discussion, I don't want to derail us, but there's also obsessive compulsive personality disorder, which is different than obsessive compulsive disorder.
Okay.
So, can someone develop a personality disorder as a result of constant exposure to aversive experiences? And the answer is yes.
Now, in my research, I found some. I created a list of things about obsessions. Now, obsessions are unwanted thoughts that you can't stop thinking over and over or get out of your head, even though you try very hard. They can seem very real, almost like your own thoughts, are almost always creepy, scary, nasty, or disgusting. Now, that one I have a question about, but I'll come back to it. It gives you a lot of doubt about things that are important to you. They keep telling you the same bad things every day or keep changing all the time. They can seem so weird that you can't understand why you would even think them. Now that's the obsessions are unwanted thoughts. Now obsessions can make you think something bad is going to happen to you or those you care about, such as your family members, your friends, your pets, etc. You maybe did something bad or illegal, like cheating, breaking rules, that you will get in trouble, and that you really want to do something bad. Another one is that bad thoughts that have you. I must have copied that one wrong. Okay. There are bad luck and good luck things such as numbers, words, names are moving in special ways that you have to be very careful about doing the right way, or something bad will happen to you or to someone else. Now, that one right there, you described that earlier
Mhm.
about don't step on the black. You only step on the black tiles on the floor. Don't step on the white ones. You step on the black ones. Um, and the bad luck with numbers and words and things that you repeat to yourself so that something bad won't happen.
That's correct. I had a
All
client
of these
that,
things that are bad,
right,
and the
the bad
thoughts.
number was three. Anything with three, didn't do anything in threes, didn't like the number three, wouldn't write the number three. See, that's stuff that becomes dysfunctional, because what if the answer to the test is number three, or 35? But yeah, and again, it's like in our sober minds, we don't understand it in our sober minds, but in a mind that's not sober and is flooded with these illogical thoughts that become beliefs, it's extremely disturbing.
So when kids start thinking these things, that if I do something, if I say something, it's going to hurt my mommy or it's going to hurt my daddy, that bothers me because I think about kidnappers, I think about pedophiles and things like that that prey on children,
Mm-hmm.
that have studied them and know, their patterns, because some predators do prey on children. They watch them for a while and see what their patterns are and know which way they go home or what they do, and they'll say something and it's their trigger word. And if they're saying it, something bad's going to happen to mommy and daddy, and they use that against them. Now, this is just how my brain functions. I promise you. I sound like I'm OCD now
No, you don't.
because of the way my brain thinks. I overanalyze a lot. But it just, that thinking about when I was reading this list, when I went back over my notes, and I was like, oh, this could be very dangerous to a child, especially one who's very protective of mom and dad, that don't want anything bad to happen to them, and somebody comes up and says that, something that triggers them, and they'll do anything to keep, from hurting mommy and daddy, including putting their own lives in danger. And that kind of is scary to me.
I can see what you're talking about. So someone who says, come with me and I'll make sure that your parents are okay. And then that just makes them vulnerable to danger, right? To predators out there who are preying on children who would basically fall prey to that.
Right.
One of the things with OCD is that there's a series of behaviors. Not all things satisfy the obsession.
Okay.
So let me give you an example. So let's say the obsession is contamination again. I will die as a result of contamination. If they have found that washing hands is what decreases or takes away the intensity of the thought, if it's hand washing, that cannot necessarily be replaced by another behavior. So let's say we say, well, if we cut all the water off and give that same child hand sanitizer, the hand sanitizer is not going to be as effective as the elected behavior that minimizes the distress. You see what I mean? So the chances of someone with OCD changing the behavior or electing another behavior to address the obsession, we don't see that much. I'm not saying it's impossible, right? So I'm walking home and I'm a door locker. I'm a door locker, I'm a phone caller, I'm a texter, whatever the compulsion is that keeps this child feeling like this is how I address this obsession that someone is going to hurt my parents. I don't think that they would fall prey to another response because it's very fixated.
Okay.
That behavior that they choose to address the obsession is very fixated. So you're talking about something outside of those fixated behaviors. And again, I'm not saying that it's impossible, but it's not just something that I've seen often.
Okay. It's just my brain.
Right.
I'm the one that at night, when I get something in my head, that one thought leads to another, and then I got to do this, and then I got to do that, and then I got to do this, and it just keeps backtracking, and I'm like, shut up, go to sleep. I literally have to talk to myself and say, stop thinking, go to sleep, stop thinking.
You have to decompress. You have to have decompression. You have to have a ritual every evening to decompress. You got to be very intentional about it.
That's hard to do because I work overnight. And that's probably what's wrong with me.
Oh boy.
Yes. That's probably what's wrong with me because I work overnight as a newborn care specialist, and I'm up taking care of the babies, figuring out what's going on. Okay, why are you crying over here? Okay, you changed, you burped, I fed you. Okay, so do you have extra gas on your tummy? Okay, let's do this. Okay, that's not working. So I'm constantly thinking, how can I get this baby out of distress? So I know it carries over. The nights that I don't work, my brain is like firing. And I have to, like you say, figure out a decompression.
Decompress, yes. Because once you have that, and once you have found a decompression ritual that works, then that needs to be your go-to, because in order for you to continue to be the amazing nanny that you are, the amazing business owner, whatever it is that you're doing, wife, mother, all of the above, you have to give your brain adequate rest. And when your thoughts are not allowing you to, that means that your brain does not sense that this is time for us to calm down. So people who work in their beds, and I know this is totally off topic, but when you're working in bed, then how does your brain know that now that we're here, now it's time to rest? Because your brain also knows that this is where we work as well. That's why it's so horrible to work in bed. We have to tell our brains, now it's time for us to turn off. Now it's time for us to rest. So when your bed is associated with the place where you work, your bed is associated with the place where you rest, your bed is associated with the place where you argue with your spouse, Your bed is it's
I'm
all about
laughing.
association.
I'm laughing because I do sleep training. That's why I'm laughing because I tell parents, okay, so we're going to put babies in the crib so they can associate when I lay down, I go to sleep.
You know this.
That's why I am laughing so hard. I'm like,
It's the
hello.
same thing.
It's like physician heal thyself. That's why I'm laughing when you start saying that. I was like, uh-oh, I'm in
We
trouble.
always know it for everybody else, but we just apply it to our own lives. I get it.
Yes, that's where I am right now. I was like, okay, back up. Remind yourself, sleep training. What are we here for? What is this place for? And every time you come to this bed, what are you supposed to do? Go to sleep.
That's right.
So if I can train babies, I need to be able to train myself.
Yes. And we'll hold you accountable to that.
Yes. So, do you have any? It's hard to believe it's 8 o'clock already. Do you have any final comments? I really appreciate you coming on and talking to us about OCD. Uh, this was very, very important to me because when I read that story, it just really disturbed me.
Yeah.
So, do you have any final comments?
Yeah,
Uh,
actually, I just want to make sure we didn't really talk about treatment much. So I want to
okay,
make sure that the listeners understand that there is treatment out there for OCD. And so medication is one of them, but it's not considered the highest, it doesn't have the highest rate of effectiveness. I think the treatment right now, or not necessarily, I know the treatment that has the highest level of effectivity as it relates to the statistics that are out today and have been over the years is cognitive behavioral therapy. And that's cognitive behavioral therapy specifically using what is it called? Exposure and response prevention. Exposure and response prevention. So basically, in that treatment, what they're doing is they're examining all the obsessions of that child. So let's say if I touch germs, I will die. People are out to get my family. Um, we will die in the house if the lights are on, all on at the same time. So we examine all of these different obsessions, and then we take a look at the one that's the less threatening of all of them, and we start exposure therapy there. So this is literally exposing the child to that fear in a very safe space and doing it in a way where they are not able to engage in the behavior that strengthens the obsession. Remember, we talked about that vicious cycle at the beginning?
right.
So, cognitive behavioral therapy with exposure and response prevention being the the intervention that is used is highly effective. Now, there's also times where the obsession is so powerful that a provider will actually recommend medication to help to aid the intervention with being successful. That's in very severe cases. So there is medication management for OCD. There are lesser restrictive alternatives like cognitive behavioral therapy. So it's up to a parent to make the decision what they think is best for their child. But I just want to make sure that it's also said that OCD does respond very well to consistent cognitive behavior therapy, specifically that exposure and response prevention, and also medication. I have heard, though, that parents who have elected medication only without the therapy to supplement, that when they decided to titrate the child off the medication, that the symptomology returned. So I can't say that's the case for every child, but I also just wanted to make that statement to just highlight the power of therapy.
Yes. Therapy, therapy, therapy. I totally agree. I
Yeah.
totally agree. Now, Thank you so much for agreeing to
My
uh,
privilege.
to be with us tonight. And I want to thank Phaedra Gray because she was the one who referred me to you when I put a feeler out.
I
Yeah,
forgot that you told me that it was her. Hi, Phaedra.
yeah, I put it out there. I was like, I need someone who deals with OCD in children. And she's like, ask Shelly. And I was like, okay, who is Shelly? So when I found you, I was like, okay. I was like, this is a long shot, but I'm going to try it anyway. So I really, really appreciate you coming on and talking with us about um, OCD in children. And this, because it really touched my heart. And when things touch my heart like that, I have to act on them. So, especially now that we are all in a shelter in place, I know it is hard for families and parents, especially if it has gone undetected until now. I know that parents are probably going like, what in the world is wrong with my child?
Yeah,
So I wanted to put it out there so that parents can take a closer look and do observations. Nannies, do observations. We observe these kids and their patterns and their behaviors every day. Do observations, write it down. And when I say observations, take your feelings out of it. Only write what you see.
that's good.
That way, when all of this is over with and they can go see the doctor and get some extended help, that you'll have a journal and you'll have records of every day at 3 o'clock he did this every day. And some kids who are obsessed with time, it's on a timetable and they have to do it at this time, at this time, at this time. If they miss that time, it irritates them. So write what you see and keep it a log of it and give it to the parents and talk to mom and dad. I am not a therapist. I am not a counselor, but I have experienced children who have these behaviors. I look back now and see it and wish I had, had the knowledge that or the inkling to say something because I was thinking OCD was one thing and it's totally different. There's more than what you think to
Absolutely.
OCD.
Absolutely.
So when I started researching, I was like, oh my gosh. So be sure when you take these notes, take them to mom and dad, take them to concerns, and don't take it to them in a excuse me in a bad way because no parent wants to know that their child's not perfect. Even if they know that their child's not perfect, no parent wants you to come and say, well, your child has this and your child's doing this. No, I have observed certain things in your child, and I'd
Right.
like to discuss them with you. Always do the sandwich. And when I say the sandwich, you start out with the good, you shelter in the bad in there, and then you leave something with something good. So mom and dad are concerned about their child. They're concerned enough to do something, but they don't think that you think that their child is a bad child or something is wrong with my child. You're there to And the best way for you to help is to do observations and to inform the parent. It's up to them as to whether they want to do something about it or whether they want to stay in denial or whatever the case may be. Don't try to do something on your own.
I agree. And sharing an article, a YouTube clip, something like that is also really powerful. Let them, read it and watch it in their own time. I mean, there are children, they're saying that manifestations of OCD can start as young as two. Two. So share an article, share an amazing YouTube clip, share your observations, like you said, say what you see, and let them make the final decision. You did your part. And then the parent is the one that is in the place to make the decision for what's best for the child and their family.
Now, I want you all to do me a huge favor. If you have enjoyed, and I shouldn't say if because I know I have, and I know you probably have, or you wouldn't be still watching. Please go by Shelly's Facebook page and like her page, leave her a review. Please go by the Ask the Nanny page and like our page and leave us a review. And you can connect with Shelly. You see that little scroll that's going down on the bottom? AskShelly.com. Now, I know that we have conferences. I know that we have like the Nanny Palooza and the INA and the U.S. Nanny Association and the APNA and the DONA and the CAPA. I know we have all of these different um, conferences that are in the birth world and the nanny world. And I'm just saying, Miss Shelley is available. You all need to contact her. Promise you. And don't you have a weekly live?
I do. I have a weekly live every Tuesday at 12 Eastern Standard Time. So I think that's 11 o'clock your time. That's every Tuesday. My page is Ask Shelly. You can also find me on Instagram at Ask Shelly. As you can see on the banner on this live, my name is spelled a little unique. My Haitian parents were extremely creative in spelling my name. So again, that's Ask Shelly, SCHELLIE. That's every Tuesday at 12 o'clock, where I highlight questions that are asked of me. And I just go live on a platform and share it with my listeners. They chime in, they become part of my consultation team. So it's pretty fun. And sometimes the topics are not so fun. They're dead serious. People, writing in about suicidal thoughts and, what do I do with my child that's cutting? And so it's all types of questions that I present that I will share to the public in hopes that they can add the information to their wellness toolbox.
And that's all I'm trying to do is add something to your toolbox. So thank you, Miss Shelley, for joining us. Thank you for agreeing to talk to me and for coming on. I really, really appreciate it. I learned a lot tonight, even though the questions that I actually had, I asked for because you kept bringing up things, and I was like, "Ooh, let me ask her about this. Ooh, let me ask her about," because I know if I'm thinking it, somebody else is
That's
too.
right.
Thank you again. And as a reminder, everyone, as a reminder, please remember that as of May the 4th, we are going to start um, broadcasting on the Ask the Nanny page. We will no longer be on my page. We're going to be broadcasting on the Ask the Nanny page. And that is starting on May the 4th. So we're going to go live on my page. Share with your friends, share with your groups. We're going live. Now, I will share this on my page, share it to my page, but we're going to be on Ask the Nanny. So come on over to Ask the Nanny. Now, yes, that way. It's opposite of what I'm thinking. But next week, we are going to have our must haves for babies 0 to 12 months. So if your parent is expecting, your nanny family is expecting, or you are expecting yourself, I'm going to have 4 baby experts on, and they're going to tell us what we need for our 0 to 12-month old. So, and it's going to be a series. So this month we're doing babies. Next month we'll do toddlers. So come back next week and find out what you need for that newborn baby on up through 1 year old. So we'll talk to you soon. Thank you again, Shelly. And be sure you go by and like Shelly's page. Follow her on Instagram at Ask Shelly, and follow her. Check out her website at askshelley.com. We'll see you all next week.